Hello, everyone. Thank you for joining us, and thank you for your interest in becoming more effective leaders. Leadership is not just about personality traits, innate capabilities, special knowledge, and skills. It is also about stepping up and participating. So, during this next hour, we will have an opportunity to learn and share. And this is where, when I say leadership, is about also being present and participating, and I truly mean it. So, we hope you are able to really engage in this content, and we welcome you to ask questions through the Q&A and also participate through the chat function. On the next slide, we have the session security information. In case there is a security issue or any kind of breach, the session will immediately end and will not resume using the same join link, and a separate email will be sent to all participants with further instructions. The next slide shows the disclaimer that this presentation was prepared for the Pacific Southwest Mental Health Transfer Technology Center. So we go by the PSMHTTC under a cooperative agreement with SAMHSA, the Substance Abuse and Mental Health Services Administration. So all material appearing in this presentation, except that was taken directly from copyrighted resources, is in the public domain and may be reproduced or copied without permission from SAMHSA or the authors. Thanks, Joanne. And then the next slide. So first, we would like to thank Joanne Bloom here. She is helping us with the tech today. And then Suganya and I will be your presenters, and we are looking forward to this time together. And I will let her introduce herself first.
Thank you. Thank you, Annie. Good day, everyone, and welcome. This is a 1-hour presentation on adaptive leadership, but we're hoping that many of you will be intrigued by the information we share and will join us later. We'll share a little bit about that towards the end of the slide. My name is Suganya Sakalingam. It's phonetically spelled, so it should just roll off of your tongue. I do have an academic background in public health and MCH, and over the last 15 years, I've extended that into a work experience around behavioral health. My current focus is equity and leadership development, and I truly am committed to transforming organizations and systems to ensure equitable services and supports for all. So thank you and welcome again, and I'll turn it back to Annie.
Great. Thank you, Suganya. So Suganya and I will be going kind of back and forth through our slides. My name is Annie Van Dan. I have been working in the diversity, equity, and inclusion space for over 10 years. My background is also in public health, having worked in the Office of Health Equity for the state of Colorado for 5 years, and also in philanthropy before joining Change Matrix and the MHTTC team. So the next slide, this Technology Transfer Center map, this shows the area that the Pacific Southwest serves. We serve the mental health workforce in Region 9. That includes Arizona, California, Hawaii, Nevada, and the Pacific Islands. So American Samoa, I see we have some people here from Guam, welcome, Marshall Islands, the Federated States of Micronesia, Northern Mariana Islands, and Palau. So welcome you all for joining us. You can see on this map the other centers and how the regions are divided and support the work in the various parts of the U.S. Joanne. This slide talks about the role and goal of MHTTC. So our role is to offer a collaborative model in order to provide training, technical assistance, and resource dissemination that supports the mental health workforce to adopt and effectively implement evidence-based practices across the mental health continuum of care. So similarly, our goal is to promote evidence-based, culturally appropriate mental health prevention, treatment, and recovery strategies so that providers and practitioners can start, strengthen, and sustain them effectively. The services that we have available, you can see in this graphic. You include webinars like today, other tools, and resources that are on our website, regional trainings, online courses, and we'll talk a little bit more about individual consultation that we also provide. And all of these are available at no cost. And so we are very excited that you are leveraging this resource today by joining this webinar. So this products and resources catalog, these slides will be available after the presentation. So you'll be able to kind of click on these links, but you're able to access a wide array of existing products that are on the website. So this includes printed materials, recorded webinars like today's, research articles, and much more. And like I mentioned, we also provide technical assistance. So we will consider more intensive TA. So if the TA information request cannot be answered by existing resources on the website, so you can email and contact us, and we will provide those resources. If they're not available, we will kind of consult as a staff, the MHTT staff, and think about ways we can support your request within our scope and available time frame and budget. So I welcome you to be thinking about ways you can leverage the resources and the support of the MHTTC. So this next slide is the MHTTC network's language that we use. So affirming, respectful, and recovery-oriented language. Today's discussion, unfortunately, we don't have too much time for it to be too interactive, but we will talk about how we can deepen our knowledge of leadership through a learning collaborative. But today, and so through those spaces, we use this language. So today is mostly Sugani and I presenting, but using language that's strength-based and hopeful, inclusive and accepting of diverse cultures and perspectives, healing-centered and trauma-responsive, and inviting to individuals to participate in their own journeys, and knowing that this is a space where we are all learning together, being person first and free of labels, non-judgmental and avoiding assumptions. We want to be respectful, clear, and understandable. And then also the language we use should be consistent with our actions and the policies that we implement and the products that we create. So that's really the introduction to our time together. And then I will pass it over to Suganya to get us started.
Thank you, Annie. And actually, we're going to get started by in the next slide by a quick reflection. And you will notice that what we're asking you to do is to answer in the chat box and just complete this phrase. I knew I was a leader when. So just a short, quick phrase that you could add on in the chat box about when you knew you were a leader. Again, don't overthink it. We're just wanting to hear from you. Others look to me for initiating change. Ooh, this is good. I do anything for services. Let's see. When I was asked to lead, I knew I was a leader when I was willing to be the change. People turned to me for answers. I knew I was a leader when people came to me with desires for change. When I was a team captain in elementary school, when I thought I was or said I was, when others on the team came to me for advice, people started coming to me. When others would ask for guidance, when I felt confident handling a crisis and directing others, people started calling me, as you know, and then I was being asked for advice and consultation. When I advocated for myself, interesting. I knew as a leader when I when I found I was helpful, willing to figure out without a guide. When you took control of our grant in order to keep our company afloat, when people trust me, support, encourage, and foster growth in others. I would like to come back and explore something that Herman is, I think Emily says, I don't think I ever have known that I'm a leader. I knew I was a leader when I decided to serve the community, when I advocated for others. Elementary school line leader came to me for support and feedback, when started seeking my advice. When I was a teacher and learned the impact of what I did in the first grade, identified by a group of children to lead them. When I felt I had no choice but to address what I needed to have happen, I began to have make a difference with the team behind the decisions and guidance I provided when others asked me to advocate for them. So a variety of ways in which people have actually come to an understanding of their own leadership. And I really love this exercise because it's quick, it's short, but when you're with a group of people and you're really trying to understand where they're coming from, being able to ask this question actually allows you to learn more about your team, allows you to learn more about the group of people that you're working with. For many of us, we recognize these leadership traits very early in our lives. And then we may or may not recognize this, and we may struggle a little bit to acknowledge our own leadership capacity. We also learn that we have varying responses as we work towards being the leaders that we want to be. When I read this list of things here, it tells me that each of us have very individual perceptions of what leadership is. For many of you, it is when people came to you to have to ask questions and to have the questions answered, and you will learn that in the work that we do, that is a leadership function that is often used, but we're going to show you a different frame of thinking about it. And it's really a recognition that that for some of us, this notion of leadership doesn't come as easily. Some of us come from cultures where we don't own or even think of ourselves as leaders. We do the work. So we come to this frame as servant leaders. So we never think about ourselves as potential leaders. And some of you have mentioned that. Some of you have said, I didn't think about it. I don't see myself as a leader. And so what we would like to do is share with you the concepts around leadership that exist, and also leadership styles that may be more helpful to us in the future. And so let's go ahead and look at what some of these leadership styles are. For instance, let's look at the leadership traits. There are people who believe that one needs to have very specific traits to be an effective leader, and this is true, but it's only one piece of the puzzle. Others believe that leaders will learn will acquire certain knowledge and will then behave in certain ways, and therefore they function as leaders. There are other people who believe that leaders are very successful because they do what needs to get done in a situation that requires somebody to step up and do the work. And so in a contingency, they become very effective leaders. And others believe that there needs to be power and influence behind leadership. And these are people who will often maybe use even rewards and punishment. These are all different ways in which we think of leadership. None of them are right. None of them are wrong. They all are different ways in which we function. And what we will find is that we will need to use certain traits and certain styles to match the need that is required of us. One thing I really want to share with you is that leadership can be both transactional and transformative. In transactional leaders, what we do is we are involved in ensuring that the processes is in place, that we control what happens, and we have a very strong management focus in that leadership. Transformational leadership is very different because what it requires us to do is inspire people, inspire them to follow. And it requires a high degree of coordination of teams, of communicating effectively, and ensuring cooperation exists within the organization to move the organizational forward. Transformational leadership is what we're going to be exploring a great deal of in the work that we do, not only today, but moving forward. In the next slide, we're going to just briefly talk about this notion that we often is something that we think we do. There are certain ways in which we believe we act and others see it. But it's very important to recognize that what others see happening as we lead is equally important, because they will react to our leadership style based on what it is they are seeing about us. And so it's a recognition that we communicate certain ways of being a leader, but others perceive it as different ways as well, based on where they're coming from and their own lived experiences and perspectives. So it's just not a one-way street. In the next slide, we are going to talk a little bit about these principles that are important, that we all have different styles of leadership, and we gravitate more towards certain styles than others. This is what we call our dominant tendencies, but it doesn't mean that the other styles don't exist. There isn't a one-size-fits-all to our approach for leaders. So every one of you, and there are quite a large group of you who are here, every one of you is a leader. You just take different approaches and different ways in which you function as a leader. What is effective is if you find different styles that you can use and you can flex them depending on the situation, depending on the team, depending on the project, depending on the decisions to be made. If you can flex, you can be a very effective leader. How we lead really can contribute to a project and to the way an organization functions. So the most important thing to realize as we think about being a leader is acquiring a toolbox of different knowledge, of different awareness, and of different skills that will shift our behaviors and our practices. And that is what is so critical. If you go to the next slide, Joanne. So something that I would love to have you think about is that this I find a very interesting sort of a poem. The lion is not the tallest animal in the jungle. It's not the largest animal. It's not the heaviest animal, nor is it the smartest or most intelligent animal in the jungle. And yet the lion is the king. It's your mind and thoughts that make you a leader. The lion is the king of the jungle because of his attitude about himself. Your attitude is a product of your belief system. So for those of you who've ever questioned whether you are a leader, hear it now. You are leaders because you have come to this session and you are wanting to be more knowledgeable and you're wanting to be more effective leaders. Therefore, you are leaders. So if we can go to the next slide. So what we are going to focus on today is on adaptive leadership. And what we're going to be doing in our learning collaborative that we will be offering in the early part of 2022 is this model of leadership that can function so effectively in a variety of different situations. And what adaptive leadership is, the activity of mobilizing people to tackle the tough challenges and to thrive, which is really, when you think about what we've been experiencing for the last year and a half, one of the most critical things that we can do. So moving on to the next slide. What is adaptive leadership? It is a leadership style that is very effective for systems change. It is a style that is really important when the issues are complex and there are no simple solutions. Sometimes even the problems are hard to identify. So it requires a group of people to come together and work creatively and inclusively and come up with ideas. It really requires the capacity of the leader to inspire others to work around this and to be able to support this, and a recognition that in adaptive leadership in the team, everybody has an opportunity to lead and everyone has an opportunity to follow. And you need followers just as much as you need leaders. In the next slide, we're going to talk about one more thing that is really critical to adaptive leadership. And this is this concept of collective intelligence. It is in the collective intelligence of people at all levels who need to use one another as resources, often across boundaries, and learn their way to solutions. So for those of you who were often asked to come up with solutions and answers, that's a scary place to be because so much is dependent on you. But if you can think of let us collectively come up with answers to these issues, it is a powerful place to be where you can learn from each other and you can support each other. Now I'm going to turn it over to Annie and not confuse her.
No problem. Thank you, Suganya. So I'll be going a little deeper into the adaptive leadership model components. And so, as Suganya said, there's been different types of leadership in different decades. So in 1994, that's when Heifetz really introduced this concept. And so part of it, there's these three elements. So situational challenges, leader behaviors and tasks, and then what the adaptive work looks like. We'll go into more on the next slide. The situational challenges, adaptive leadership is required in these type of challenges, but not all challenges are adaptive in nature. So one of the first things we have to be able to do is differentiate what a technical and adaptive challenge is. And in certain cases, a situation is both. And so we will go a little deeper into that and kind of practice our own understanding of what the differences are. Then for leader behaviors and tasks, these six elements we will also go further into. But once we have been able to identify that adaptive work is needed, there are several behaviors that need to come to the forefront to really support the process of adaptive work. And then adaptive work includes these elements: create a holding environment in that third column. It requires leaders to hold the space for this interactive and iterative collaborative work in which mistakes will be made and from which we will learn and adapt and successfully address our goals. So this slide is a good overview of the whole model, and then we will go a little deeper into all of these. So sharing your thoughts, what is one task or responsibility in your work portfolio that requires adaptive work? Some of you shared already, but please use the chat if you have any specific examples of basically when you don't have just like one solution to the problem. Okay, so Tarinda shared that guiding interns is adaptive. Yes, I think, working with different people and personalities and knowing that there's different ways that they would like to be, onboarded or brought to the team can be adaptive. Great. Working with more rigid team members, collaborating with external partners, guiding youth leadership development virtually. Yep. Yes, I think can all be very challenging. And it's interesting because a lot of times our challenges do fall under both technical and adaptive. Managing the CMS COVID mandate. Yes, I think when we have to roll out new policies, it can be very adaptive work. Mentoring faculty members, working with different age groups, yes, and with different multidisciplinary teams, again, with supporting different staff. Thank you for sharing. I know we're kind of have a lot more slides to go through. So I think some of the things you shared, like in addition to like diversity, equity, inclusion work, collective action on a project, going through any type of organizational change or restructuring, and also just implementing new policies, as was shared, can all be very situational challenges that are adaptive. So the next slide, Julian. With technical challenges, let's take your work into consideration. So things that you all have just shared. There are challenges you meet that are easy to define. They have a very clear solution. Oftentimes this is like knowledge development or taking a training, and it has like a technical answer. So things like maybe there's something wrong with your computer and the computer just needs to get fixed. When a problem that needs a solution at work that's technical, not only you, but other people can see and define the problem in the same way. If there is agreement on what the problem is, and there is often agreement on a clear solution to the problem, it would be a technical challenge. Because of that clarity, the leader can just implement the solution, and most likely people are happy that the problem is taken care of. So the example here is allocating funds for a community-based free dental clinic, so that the challenge is just the solution to the challenge is just to be able to allocate funding. The next slide talks about adaptive challenges. So adaptive challenges are much harder to define. And so many of what you shared is like when we look at onboarding new staff or working with new partners and these kind of like relationship challenges, it's hard to even define like what the challenge is. Is it because of past issues with a relationship with somebody? Is it because somebody kind of what was shared is more rigid? It's like really trying to be more figuring out like what the actual issue is. Part of the problem is that individuals, most of whom are committed to serving within their role, they might see the problem differently. So before we can even kind of tackle what it is, we might not even view it as the same thing. So with the changing demographics of our society and with the recognition that social determinants of health play a tremendous role in health outcomes, we are left with a very difficult problem with health disparities and how people address these disparities in different ways. So providing culturally responsive care to a racially, ethnically, and diverse clientele can also be an adaptive challenge. Through adaptive leadership, the organization can identify the complexity of the challenge and all its tensions and conflicts that can be uncovered, and a solution for the entire group may emerge. So it really does take a lot of individuals to be involved and engaged in the process. The leader cannot make this happen on their own. So the example here is getting residents to come to the dental clinic biannually for their cleanings. So again, sometimes it's when it's relationship based, it becomes much more of an adaptive challenge. The next slide then talks about how, in many cases, it's a little bit of both. And so thinking back to your examples that you shared in the chat, like how can you approach those challenges from a technical solution perspective, and then also from this adaptive viewpoint. So these type of challenges needs people at all levels have to use one another for resources and support, crosses boundaries to learn, and this takes adaptation. So the one that was shared about kind of the COVID mandate, I think definitely you can see the technical challenge. It's like, oh, is this solution is just to mandate this, to roll out this policy, but there's much more adaptive work that needs to be done to really understand what different challenges are, like why certain people might not want to kind of follow these mandates that are happening, currently. So very relevant challenge around COVID. The example here is then ensuring dental clinic staff are culturally aware and responsive to the needs of the community. So one technical solution could be, okay, we provide trainings, we do culturally responsive trainings, and then that kind of checks off the box that we trained our staff to be culturally aware. But then the adaptive part is to really think about how we're implementing that work, the training that was learned, and how when situations arise and you're working with different clientele, that you're actually using the training. The next slide then shows technical versus adaptive work. This chart kind of goes into a little more detail around like what kind of problem solution it is. So again, having the clear solution for the technical and then a more complex solution for adaptive. And then who's doing the work. Technical, oftentimes, again, using the example of like fixing the computer or getting a software downloaded. It could be a challenge that you bring to an expert, the technical assistant or the IT person that fixes the computer, and then expedited fix, so it just gets fixed. The technical and adaptive, it requires learning a new way of doing things. It could be both the expert and then the person involved, the stakeholder that have to come up with a solution together. And then the adaptive challenge is much more involving of all stakeholders involved. So people at all levels of the organization who are able to give input and influence. Next slide. Again, we will be sharing the slides because I know we have quite a few slides to get through, and you might want to spend a little bit more time looking at these charts. This one shows the responsibilities of an adaptive leadership. So things like taking direction or giving direction, protection, orientation, and managing the conflict. and also shaping the norms. So in each of these, we show what the technical kind of solution or approach would be, and then what a more adaptive approach would be, and then what the skill looks like. The next slide is a poll. So we'd like to kind of, now that we went through this example, get a sense of what you all think the answer is to this situation. So a client is struggling with preparing healthy meals following his diabetes diagnosis. This is an example of what type of challenge? And how would you, approach it? So would you provide like an adaptive solution, a technical solution, or does it require both? So we have about 70% saying this is both adaptive and technical challenge, 25% that it's adaptive, and then about 5% that it's a technical challenge. So very interesting. And I think it could definitely be both. So as we were sharing, how in a lot of these situations, depending how we approach it, like first trying to identify what the issue is, right? So without the complete context of what's going on, I think we can make some assumptions that if it was a technical challenge, like our solution would be just to make sure the client has the food and the ingredients, the recipes that they need to prepare the healthy meals. And so again, kind of feeling like, okay, well, we address the challenge because we provided the resources needed to be able to make meals, so they should be good, right? But the adaptive challenge could be much trickier. We would need to consider the client's ability to cook, their interest and motivation to be healthier, knowledge of the importance of this lifestyle change. As we know that asking someone to engage in a significant behavioral change, it can be very challenging. And often the adaptive work is really that we have the buy-in of them to, kind of participate and, provide feedback on what the challenges are for them and being able to kind of meet them where they're at. Great. Thank you. So this image says here, trying to address an adaptive problem with a technical solution is like having a car with no tires. You can start it, but it won't take you anywhere. And so I don't know how many of you can think of an example where maybe you're sitting on a steering committee for work or a small work group, and you're just kind of talking and talking in circles and trying to really even figure out like what the group is trying to do. So oftentimes the reason that happens, and people end up getting very frustrated and disengaged in the work, is because the initial challenge, what type of problem was not really defined. And so everybody's kind of sitting in that space with different goals and thinking that the group is doing different things. And so that's what this image is trying to show here. Great. So now Suganya will take us more into the leaders' behaviors and tasks.
Let's go on to the next slide. Because what we're going to do is talk about the 6 tasks of leadership. And Ron Heifetz, who actually has a background in public health, really was looking at leadership and recognized that so much of the leadership was coming from the commercial, the corporate sector. And he said it doesn't really apply to the work that we do in public health. And so he then thought about what would it look like in public health? And it's from his frame of thinking that we now have this concept around adaptive leadership. And as you think about this adaptive leadership, and as you think about the conversation that we just had in just this last 30 minutes, it's easy to recognize that we have to lead in different ways in order to be able to achieve the very complex, challenging things to do. I mean, one of the things is I often use this metaphor. Some things are simple. It's like a cake recipe. You get all of the ingredients, you put it together, and maybe a brownie recipe because you don't have to worry about it rising. You put all of the ingredients together, you bake it, and then you have this incredible, brownies that you can eat. So it's a simple issue that requires simple and technical solutions. You then can have something complicated like building the rocket. Well, it's not as simple as making brownies, but there is a lot of parts that need to go together. It requires a lot of incredible skill. But the design is there, the instructions are there, all of the materials needed are there, and therefore it's a complicated challenge, but you can address that. The reason why we talk about adaptive work is that the work we do, serving people, providing services that are culturally appropriate, that are comprehensive, that are person-centered, that include the family and the community, these complex changes, there is no recipe out there. One organization does it a certain way, another organization may have to do it in a completely different way. And because of that, we really need to think about this as complex changes and that require us to function as leaders very differently. And some of these tasks and these functions are like getting on the balcony. It's sometimes people will say, I don't have this luxury of thinking about this or reflecting on this. I just have to get the work done. But what getting on the balcony requires us to do is ask these questions. What's going on here? How are people feeling? What are people experiencing? Who's talking? Who's not? So think of yourself as being in a dance and you're on the balcony and you're looking down at the dance floor. Who's dancing with whom? Who's not dancing? Who's standing on the sidelines? What group is sitting around and talking? Who's at the punch bowl? Those are the kinds of things that you get to see when you're on the balcony. But you can't stay on the balcony forever. You do have to get down onto the dance floor and get the specifics and the details. And that's what adaptive leadership requires, getting on the balcony. And as in the next slide, we can say, once you've gotten on the balcony, then you get down onto the dance floor and then you identify the adaptive challenge. What is causing it? What are we seeing as symptoms and issues that are both on the surface and deeper? Does it require us to do different kind of work? Are there some simple technical solutions we can offer? Are there, adaptive challenges that we need to process and think about? Do we need to bring a group of people in to explore it? So those are all the different ways in which we need to think about it. And how much time do we need to take? Oftentimes, people will want to address an issue very quickly because they can't stand the chaos that it creates. And therefore, they will rush through it, but it may be the wrong solution. And then they have to backtrack. So it's exploring all of those things that are important. The third task of leadership is regulating and pacing distress. Anytime we're doing transformative work, the kind of work, the complex challenges that require us to do adaptive work, it's going to require us to do things a little bit differently, and that can create stress. But what is important is that if we don't have sufficient stress, then we don't push ourselves out of the way we usually do business. It's same old. Whereas, and so that level of stress is important. But on the other hand, if there is too much stress, people can shut down. People can get so exhausted. People get burnt out, too much fatigue. And so it's one of the things that we do as adaptive leaders is we have to regulate and pace this stress. The fourth thing that we have to do is that we really have to maintain disciplined attention. And what it means in this is that, and I think you may have even experienced this in your team meetings. Say a group of you are getting together and everybody is talking about a particular challenge, a particular issue that is going on. It's a very difficult issue. It might have to do with staff at workforce development. It might have to do with the kind of tension that is occurring because the workforce is changing and the people who are working together may not have worked together before. And so the dynamics of that work has shifted. And it can be because of different cultural perspectives. It can be because of very different lived experiences. It can be because people see things from very different cultural lenses. But because of that, it's a difficult issue to deal with. And when you are in this meeting and talking about it,
A couple of people might be on the sidelines, sort of chatting with each other. A couple of people are, getting onto their phones or their computers to look at their calendar to see what's happening. That is because the issues that are so complex are challenging, and therefore people are trying to avoid it. It's called what we call work avoidance. So as adaptive leaders, we really have to focus in on it and keep people together and maintain that disciplined attention that is needed. The fifth piece is about making sure that everybody in the team, everybody in the group, everybody in the organization is working together to address this issue. How many of you have said, oh my God, I know I should delegate, but I don't have the time to delegate. It's too difficult to delegate. That is a challenge. It means that only one person is addressing the issue. There is no collective intelligence that's coming together. There is no group looking through the issues and identifying a variety of strategies. And so it really is important to engage everybody in this work. And the sixth task is a task that is really, really critical as we think about some of the work that we are doing right now. Many of us are trying to change our organizations to be more diverse, to be more inclusive, to create a sense of belonging. Many of us are working around equity. Many of us are trying to address disparities. Many of us are trying to ensure that family engagement, peer involvement, peer engagement is a part of how we provide services. If we don't pay attention to all the people who need to be in that conversation, then people are going to be marginalized and people are going to be alienated. So our work as adaptive leaders is to ensure that all voices get heard. And so when you think about these 6 tasks, tell me, how many of you have ever gone to a management training or a leadership training where these kinds of issues that are so fundamental to how effectively an organization can work ever get addressed? I think that is why we so appreciate Heifetz for giving us this framework and this way of thinking so that we can begin to really transform the organizations that we are working in to ensure equity, to ensure diversity, to ensure all voices get heard. I'm going to turn this over to Annie, who's going to talk about the other aspects of this adaptive work.
Great. Thank you, Suganya.
And before we do that, we want to do this poll as well. So,
great. Thank you all for filling this out. So which of these tasks pose the greatest challenge for you?
I think what we're seeing is that for many people, the work that is involved, the tasks involved in doing adaptive work is a huge challenge. And if that's also the case when it is both adaptive and technical. And some have said some of the technical work can be challenging as well, because some of the technical work may require some adaptive work to first get done before you can actually get to the technical work. So I think that where we are recognizing that any one of these can be challenges for us. Thank you.
Thank you. Yes, sometimes a technical challenge is hard too. Like, I don't know how to fix the computer, so that could be very stressful and time consuming, just spending a lot of time figuring out what the solution is. Okay, so we have 15 more minutes together. And during this time, I'm going to talk more about what adaptive work looks like, and then also what opportunities we have to work together more in the future. The next slide goes into the first element of adaptive work, which is to create a holding environment. So providing an environment where people feel safe addressing difficult problems and solutions. So many of you in your examples talked about well, the challenges have been working with new people, different perspectives, different age groups, people who just bring different experience and background to, your workplace or through your clients. And so being able to have this space where people feel safe, it's a neutral space, where they're welcome. I think many of you know that there's been a shift from just talking about diversity and really moving into what inclusion looks like, and how can we create spaces where people feel included and able to speak. And that is part of the role as the leader. It's a tough job, but you need to ensure that everyone feels that they can engage in this dialogue and work without any like repercussions for things that they may share. The next slide is around the interactions of a leader and a follower. So as Sugani was saying, it's like we do need, followers in different spaces too. And sometimes, we're the followers in different challenges as well. When we are all leaders, then we need to be comfortable taking on different activities and ways to proceed as the challenges shift. We learn to become skillful both in leading and following. This requires us to be observant, listen, reflect, and shift our roles as needed. So being self-aware, keeping an open mind, active listening, asking open-ended questions, and then also being courageous, being open to change and not, always doing things the same way. Our values, beliefs, attitudes, and behaviors, also affect us, right? And I would add here too, like our bias that we bring into different situations. So we want to be aware and reflective, take that stance to be able to shift as needed. And so that's where I think the word adaptive is so important in this type of leadership. Is that we have to be able to kind of adjust. So much of this becomes very relational too, in our ability to work with others. So some strategies here is to know yourself first and what you're bringing into that space, like what those beliefs are, engaging and listening, and also learning about others, and then being open to the need for change. So again, when we think about some of the examples that you shared in the chat, hoping that you can kind of look at these slides and this content around like what are some good strategies that might help you approach some of those challenges that you're facing. So the next slide is priorities, resources, and power. So we also need to explore competing priorities, the resource allocation, and power sharing. And so we know, and I'm sure we've all had, different leaders we've worked with or for, managers, supervisors that I think kind of struggle with the power sharing, right? Like a lot of times we perceive leaders to be the person that's sitting in a position of power, who has the title. And so adaptive leadership is really trying to kind of break apart those boundaries and those perceptions and notions that the person in the kind of highest seat is the one that's the leader in the room. So some strategies here are to determine the different and competing priorities that exist within the group. And again, as I was sharing earlier, oftentimes we will join a group and realize that actually everyone has different priorities and are hoping to get something different out of the group. And so being able to just even identify what's going on. And sometimes that takes, a lot of work behind the scenes of like talking to everybody individually and creating the space that they might not always feel comfortable sharing in the larger group, but on a one-on-one discussion, they might be more willing to tell you kind of what some of their issues are, or things that they want to prioritize. Also identifying resources needed and whether shifts are needed, and then examining the different powers that exist and the opportunities to use wise power. So I was recently just in a group where suddenly we ended up revisiting the whole, it was the charge. It was kind of like the charge of the group, what our goals were. And we actually ended up having to go back and rewriting the whole thing, because at some point we realized after meeting for several weeks that the initial charge and what we were there to do wasn't exactly reflective on what the group's vision was. And so sometimes, again, here being adaptive and being able to shift as you can feel that, the needs of the group is shifting. The next slide is about sacrifices. So similar to being able to identify kind of where the priorities are, we also need to explore what sacrifices have to be made and by whom. So creating a holding environment for sharing and vulnerability, that's important. And through that, you can kind of really uncover more of what people are feeling. And then exploring sacrifices that will need to be made to get to the needed changes. And so what's interesting from a leader perspective is that sometimes the sacrifice is really, stepping back. And so kind of going back to one of the approaches that Suganya shared around kind of getting on the balcony. It's like you don't necessarily have to be involved in every conversation, and being able to step back from those conversations and let others, lead and guide the conversation. Like sometimes that's when it could be a sacrifice to you as far as feeling like, okay, well, maybe I'm not being able to share my perspective in this conversation. But knowing that that can help steer the conversation in different directions. Because sometimes when you do hold a leadership position, as many of you shared, it sounds like you supervise and manage your staff or team, that sometimes just being in the room affects the what people are willing to share in that space. And then recognizing and honoring the sacrifices and persons having to take these steps. This slide on leadership and vulnerability. So part of adaptive leadership is that it requires a shift in the mindset. So it can often be very scary, but the kind of end result can be very releasing, and it's like you have to go through the whole process to get to that point. So part of it as being leaders is that we have to be vulnerable. That also allows others to be vulnerable and be more willing to share. So don't hold in your feelings, become more self-aware, and then explore your own emotions, like what's causing you to kind of react a certain way when there is conflict. Like, how are you addressing the conflict? Like, why are you maybe getting emotional about certain types of conversations or towards certain people? So being able to just do that own self-reflection is important. Vulnerability is not a weakness. It takes true strength and courage to allow yourself to be vulnerable. Fear and criticism will always be there. And I think especially when we step into leadership roles, the best course of action is always to show up anyway and move forward. Perfectionism, and here you see in the quote, is about fear and avoidance. So focus on being the best version of yourself despite your flaws. The quote here says, shame loves perfectionists. It's so easy to keep us quiet. And so a lot of times I think when we want everything to be perfect, it keeps us from, moving forward at all. And especially in these big groups, right? It's like if we kept focusing on, what our mission is, and sometimes we spend so much time just trying to write a mission statement. Sometimes it's like, okay, I think we need to be, kind of okay with this version that we have so that the group can move forward. And again, we can revisit that as needed, but that way we're not just completely kind of stuck in the work. Dare to be yourself in all your glory, your strengths, skills, sorry, John, and beauty, as well as your flaws and insecurities. Great. So again, as Gani and I were sharing, this is really an introduction to adaptive leadership and this shift in the type of leadership that's needed in the mental health and behavioral health workforce spaces. There are also continuing education and constant learning opportunities. So we wanted to share more about the next slide on the Leadership Learning Collaborative. So this is an opportunity to deepen your understanding, knowledge, and skills in adaptive leadership. Through these sessions, we can get much deeper and work on actual, challenges that everyone's experiencing in their workplaces. We can really have a peer-to-peer support and discussion around kind of some of those examples that were shared today. So what this is the Leadership Learning Collaborative. There will be an application process in December with the first orientation session that will take place in January once the participants are selected. There will then be 6 2-hour sessions. So these will be twice a month, February through April. And then some pre-work and post-reflection activities. So approximately 2 hours, like in between each session, where we will have different exercises that you do to reflect and kind of work on certain areas that can really improve challenges you might be experiencing at work. And then after the learning sessions, we will have 4 group coaching sessions on specific adaptive leadership skills and strategies, and that will be through May through August, so next summer. So we invite you all. This is our introduction to sharing about this program that will be available, but we invite you all to stay connected and then apply when the application comes out in December. Next slide is just a wrap up question to you all. So, if you could share what is one action you will take after this workshop, maybe something you learned about adaptive leadership. So, if you could take a moment to think about one of the challenges that you might be experiencing or the one that you might have shared, what is one thing you can do to address that challenge or maybe look at it a little differently than you did coming into this session? Oh, great. Yes. Embrace my own vulnerability. Wonderful. Oh, good. I knew I was a leader when exercised. So that feels like a technical solution that we could reuse these exercises and things we learned in other sessions. Loosen my grip. Yes, definitely empowering others. Being vulnerable is a challenge for me and embracing that. Oh, good. Continue to reflect on ways I show up, both good and bad. Holding space and sacrifice my time, giving input to really hear and reflect back input from others. In the team, everybody has an opportunity to lead and everybody has an opportunity to follow, and you need both. Good. And so, a lot of this information that we share around leadership, it's probably things you might have heard in different spaces. So what's good about participating in these type of trainings and webinars is like this refresher that now that it's kind of top of mind again, right? So as you approach your work tomorrow, you might be thinking about some of the things that you learned today. So taking a different perspective. Yes, I like the example of getting on the balcony, giving grace. I've come up with some questions for myself to answer about my environment. Oh, good. That will help me be more responsive to those that I work with and to identify challenges. Great. Listening more and intentional listening. Okay, we'll follow up with the application.
Yeah, I think one of the things I love so much of this information that we're going to probably save it and kind of create a little document about it that we can also add along with the presentation and recording. So I think we only have a couple more minutes. So one of the things we wanted to share is also this particular quote: individually we are one drop, together we are an ocean. And so we don't have to be doing this leadership work all by ourselves to address the behavioral health needs of our communities. We can do it together and to do it collectively. You can reach out to us to access any free resources we have. Our newsletter is chock full of information, and you can always contact us for more information through our email and through our website. So we look forward to many of you having an interest in applying for the Longer Learning Collaborative. And we look forward to having continued conversations with all of you. Thank you so much for being with us this last hour.